Hey, sports and health fans, Coach Frank here, and I need to call a timeout. I have been taking for granted how I and the patients I treat have been becoming champions at whatever their game is in life. Have you ever noticed some are champs and others struggle? I've been seeing more and more barriers preventing people from getting on with their game. I'm talking about pain, inflammation, excess weight, and even environmental stress people carry around physically. But just because these things are so common is not what makes them the silent pandemic they've become. The real problem is what people's lack of understanding has led them to do about it. From living with it and letting it worsen over time to more drastic measures like addictive drugs, meds, and even surgery, it has gotten way out of hand, and it's time we tackle the elephant in the room before it crushes us. My guest today is a colleague in the chiropractic profession who has uncovered the problem and not only fought back using many successful alternatives, but has revealed a common denominator which gives everyone champion potential. That's right, that means you too. So sit down and dial in while I bring you the interview that will change your game to your advantage and make you the winner you deserve to be, no matter what game you play. You don't want to miss this one, so stick around.
Game on, sports, fitness, and health fans, with another episode of the Sport and Good Posture Digital Radio Experience. Gear up for Coach Frank's advice from the sidelines as he helps you crush your game, no matter what sports, health, or fitness game you play.
Hey, this is Coach Frank. I'm sporting good posture. What are you sporting?
Hey, Coach, what do you got for us today?
Welcome back to another episode of Sporting Good Posture. Coach Frank here, and do I have an episode and interview for you today? I've got a guest here who has seen it all in his Scranton, Pennsylvania clinic and has helped some of the most impossible cases back to health against all odds. He's discovered a silent pandemic that exists that no one seems to be talking about, but is keeping people off their game with pain, inflammation, excess weight, declining general health, and on and on. But don't worry, it's not all doom and gloom. Though he's on a mission against some of the harmful measures people commonly take, especially with regard to addictive drugs and meds, he's a staunch advocate of alternatives which actually get results, and he uses them in his clinic to do some pretty miraculous things. And I wanted to have him here because we share this in common, and many people still don't know about these alternatives, even right here in my own clinic, where I use many of the same treatment protocols. So you're in for some powerful truth and some advice on how to release your inner champion, something that turns out to be common to everyone. And I'm going to let him school you on that in just a moment, right after this short message.
Where do you carry your stress? Whether you carry it in your shoulders, hold it in your neck, or feel it in your back, it's usually not chronic, but it's always annoying. Carrying stress isn't normal at all, but how can you know for sure how the stress you carry can be hindering you? The answer is the Advanced Postural Impact Screening at Ideal Health and Wellness Center. Chiropractic studies have revealed that posture is more than just how straight you stand. It measures spinal and skeletal support of every body function. Poor posture reveals trouble areas in your basic structure, interfering with body function, leading to pain, discomfort, tension, sleep trouble, and even digestive issues and allergies. There isn't a body function that isn't potentially at risk. Dr. Margella conducts the Advanced Postural Impact Screening to trace back postural issues to their origins, which often have been accumulating over your entire life, to find the real reasons things haven't been working their best. And that means everything when you're trying to reach your ideal performance. See where the sources of the stress you carry lie, and find out what you yourself can do about them. Call Ideal Health and Wellness Center at 615-567-6683 now.
All right, so my guest today is a fellow doctor of chiropractic who has been in practice for 25 years and counting, and proves every day in his clinic what a skilled doctor he is and just how his patients feel about him. Walk around his clinic up in Scranton and it becomes very clear how his patients respond to him. And many people have been with him for years, from fibromyalgia to chronic joint, disc, and knee injuries, to weight problems and even less chronic stress issues. He has scaled all of it and more. And even more importantly, he has helped people get away from and avoid some of the most dangerous alternatives like addictive painkillers and medications, even surgery. In 2020, he was hailed as one of America's best neuropathy physicians and was recognized by Dr. Eric Kaplan, co-chair of the International Medical Advisory Board on Spinal Decompression, as one of 2021's best in the field. Most people up there in Scranton know and love him for his kind heart, his sense of humor, and how good they feel just hanging around his clinic. And it's my pleasure to bring him here to share some of that with you. So please welcome the Sporting Good Posture, Dr. Emanuel Vito. Doc, welcome to the show.
Hey, it's great to be here.
Hey, I appreciate you doing this on a Sunday. I know you're probably getting ready to get your pasta going and your sauce going for the day.
How'd you know that?
Hey, man, us Italians, we got to stick together, you know?
That's right. That's
so
funny.
You've been in practice around 25 years. I've been in practice around 15 years. So I know when I came out of school that the opioid pandemic wasn't really around at that point, and probably wasn't around then 25 years ago. So how did you start coming across this more, and some of the cases that you've seen with this where it's become more prevalent in your practice?
It started years ago with, things like Vicodin, or it went on to tramadol, then it went on to oxy, then it went on to morphine. None of it's benign. And they tried to make it sound as though it was. And, some of the things are, quite insidious. So people will say, for example, oh, tramadol is nothing, for example, or oh, Vicodin, it's nothing. Well, you're still stimulating opioid receptors in your brain. And, what happens, it's just the beginning of an addiction, which really never handles the problem. And by the time people are ready to handle the problem, and in the cases back then, a lot of times it was surgery, or before, laser and decompression were prevalent and widely available. By the time those modalities came around, people were already hooked. Of course, there's a whole psychology, if you will, behind addiction, and what people do to maintain it, and it actually gets pretty scary.
Well, thinking about that now, you're right. I didn't even remember some of those from years ago. Yeah, like Vicodin and stuff I remember in the 90s, and then you're right. There's a lot more that have come out over the years.
And even before that, there was Darvocet and Darvon, and that's since been taken off the market. So,
yeah, and then also some of the newer ones now, because we're just bombarded by commercials all the time with this. Every other commercial is some kind of medication on there. Why do you see that it becomes such a widespread problem? Not just where you are in Scranton or where I am in Nashville, but really everywhere now. You hear about this more. Why do you think it's gotten to the level it's gotten so quickly now?
Well, because the genie's out of the bottle. Number one, because it was allowed to happen. It started with the great lie, oh, OxyContin's not addictive. That was the real one. That was the worst of all, because it's so powerful and so addictive. And then of course there were doctors that were more than willing to take advantage of that and created these pill mills and threw everything at the patient that they would take. And once someone's addicted, and you throw, let's put it this way, if you throw a bag of jelly beans in front of a kid, he's going to want more jelly beans, and he'll make every excuse to have more jelly beans. And it's the same thing with opioid addiction. And then it goes on to, then they started making combinations of medications where, they combined different types of psychotropic drugs with the pain relievers. And, that just created a whole other problem. And it just simply put the person into the mud, into their addiction that much farther.
I noticed where I am in Tennessee that the main pathway, if somebody has pain, is go to the doctor, and here's these pain pills, or go home and rest, and take some over-the-counter medicine or whatever, or they prescribe them something. So there's never really more of a pathway than just that. It just kind of limits people. Yeah. So I feel like, I don't know if that's how it is in Pennsylvania, but I feel like a lot of areas that's the pathway. There's really no other options besides meds and rest, and that's really about all people tell them.
Well, it's tough when you have people who are the gatekeepers and don't want to hear. I mean, now it's getting a little bit better, I think. But they're sending people, and nothing against physical therapy. People should exercise and motion. Yeah. Someone told me once, in the first year in chiropractic school, his dad was a chiropractor. And he said, Dad always told me motion is life, and that's true. But when it comes to the actual success rate of physical therapy and back pain, it's very low. After 6 weeks, it's some crazy. It's some number that's like 2% or something. Yeah. It's like a very, very low improvement with significant, moderate to severe low back pain. Anyway, and you also have to remember too that, and doctors are getting a little smarter about this, and they know this. Everybody knows this, that after about 2 weeks, many conditions are going to resolve anyway by themselves because the body does have an innate ability to heal. So the approach is definitely way more conservative now, and thank God it is.
So as far as PT, because, a lot of people, when they think of back pain, they usually think of, oh, I need to go to PT. Can you explain a little bit of why PT helps, but not really fixes that problem as much as it should?
Depending on, of course, what the problem is. The idea is, if you look at the nervous system, and if you understand that everything starts with the nervous system, doesn't mean it always ends there, but it starts with the nervous system and many times as far as back pain goes. So if you have a nerve root that's compressed because a vertebrae is misaligned, for whatever reason that is, it could be trauma, it could be someone moved the wrong way, so to speak, or slept the wrong way, or really did a really hard workout and their muscles are tight and they're putting extra pressure on the spine, and then the spine's getting moved out of place, which compresses the nerve root as it exits the spine. And of course, that'll cause pain. So once you look at something other than just muscle soreness or, oh, I overdid it, in other words, you need to really get to the cause of it. And exercise programs don't necessarily do that unless the cause of your back pain, of course, is just, simple overuse of a muscle and it's in a spasm, and
right.
And then it begins to go away. Not to minimize what they're doing, because they do provide a good and legitimate service, but
absolutely,
it's just not utilized, in my opinion, properly, because it's not. And I don't know that they really understand that.
What I've found over the years now, dealing with this more recently, is that when people do both PT and some other alternative therapies like chiropractic or spinal decompression or laser, they're finding better results because they're combining those two things, and that you're removing the interference finally, you're getting the blockages out of there so that the body can start moving better, and then you're strengthening the muscles that may have been weak or imbalanced. And I find that combination seems a little bit better. Is that kind of what you're seeing too?
I am. It's the neuromusculoskeletal system. Okay.
Yeah.
So it means nerves, it means joints, it means muscles. So you really have to address all three aspects of it. And, at heart, I'd love to be a purist and go, listen, I'm just going to treat this guy chiropractically and he's going to get better, and the ocean's going to part. And it doesn't always work like that. I mean, if that's the one thing he needs, sometimes it does. Like, we do see miracles in our offices. There's no question about that. But that's not every single case. So, we try to adjust all aspects, including the discs as well.
Yeah, that's the same with me. You mentioned, about using some of these therapies. When did you first start using some laser and decompression, some spinal decompression in your office?
Well, actually, I was one of the first guys. I think I started in, I think it was still in the 19s, maybe
nice.
2000, maybe 2000. As soon as laser became available, we utilized laser. Laser is great because it not only reduces pain, it does a great job for that, but it also stimulates the body to heal. And let me just back up. There are two different types of laser, basically two different categories. And one, we can just, for simplicity's sake, we'll say there's a cold laser, which doesn't cut or burn the skin. So it's not used for surgery, but it does stimulate the cells to heal, because there is a part of the cell that likes the light frequencies and it gets it to heal. It gives it energy, gives it food through the light, and it creates a healing process. And then there are those surgical lasers which cut and are used for surgery. And of course, thank God we have those as well.
Yeah. So I use the same thing. I use that cold laser there. We started using the spinal decompression. I probably started doing that about 10 or 12 years ago. I remember when I first came out in practice, it wasn't as publicized. We did a little bit in school, but it was more after the fact that I started seeing this more and more. And I did feel like it helped really enhance the healing abilities like you were talking about. What kind of conditions are you treating then with the laser and the decompression in your office?
Well, certainly strains and sprains, knee pain, any kind of pain where there's a meniscus or a disc, those types of things as well. That's what basically we're doing. The laser decompression, of course, we do have a product, and you might have one also for knees. Do you have a knee decompression type of
No,
machine?
but I've been hearing more about this recently, and I want to look into that. Tell me a little bit more about that, because I see a lot of knee problems.
It works very well. I mean, getting rid of the trigger points, right, and the soft tissue problems, as well as addressing the ligamentous issues with laser, right, is really good, and it's important to do all those things first. But there is a device. It's called the Neon Track, and what it does is it actually decompresses or separates the knee joint a little bit so that the fluid, because discs and knees, the meniscus, there's not a lot of blood flow there. But it does live, right? It does get its nutrition, as you know, through something we call imbibement. So every time we move, it creates a pumping type of scenario. So the motion is very important. So if you're using a decompression table, or if you're using a decompression machine device for the knee, it basically, in a non-weight bearing position, pumps or gets the body to pump fluid back into the area which contains all the nutrients that your knee or your back, your disc, needs to heal. And then, of course, once we're done with that, we'll use laser treatment, because laser, again, helps to relieve pain, but it also enhances the body to heal and helps with the integrity of the fluid as well.
That's very interesting. I've definitely heard more about that probably in the last year or two. I've heard some good things. And honestly, just myself, from playing football and a lot of sports when I was younger, I can tell I've put some wear and tear on my knees, and that would be something I could even use for myself. But I have a lot of patients that come in that are golfers and still athletic and still run and are active. So I know that they're having those knee issues as well. And we even do custom orthotics in my office to help with that as well. So we try to work from the ground up, but that's right. Interesting about that knee device.
The orthotics are a great thing as well, because let's face it, posture starts at your feet. And
exactly.
I know myself, I've been wearing custom orthotics since I was in chiropractic college. I had some.
Same here.
Yeah, really, right. That's where I was first introduced. Yeah, and I had some lower back pain in all the labs, right, in the anatomy laboratories. After leaning over the tables all day, my back would bother me, and it really made a big difference. And I know even now, 25 years later, when either my orthotics wear or my sneakers wear, I get knee pain, and guess what I get? I get back pain. So posture definitely starts at the feet, and a pair of custom-made orthotics definitely makes a big difference.
Yeah, I'm big into that, and I've been doing that for a long time now, and we scan every person that comes in the office to see if they have imbalances in the feet, because it does create that imbalance all the way up. So I'm glad that you're doing that too.
Yes,
great point. I see a lot of relief just myself. I've worn those for years now, and I tell you, it helps me work out better. And I can see if I ever forget to switch them for whatever reason, if I didn't switch them that day, I see a big difference in my posture and in my ability to work out or whatever I'm doing that day.
Yeah, so there's this very simple thing that works very well. And what's nice about it is it's an ongoing type of therapy, where it's something that you can not so actively have engaged every single day. So that's good. It's definitely a good form of it's a good adjunct, put it that way.
So when you're doing these treatments on patients, what would you suggest to them to kind of be aware of, if they have been taking any kind of these opioids and, are trying to find an alternative route? What do you kind of show them in your office or send out in the community to kind of help with this problem?
Okay. Well, first thing is, if the patient truly has an issue with pain and it hasn't gotten to the point where there is a dependency, even still, they had pain. That's what got them there in the first place. And I'm sure they still have it. So now we're juggling, because sometimes when you do have someone in with that are on the opioids or opiates, there's that psychological dependence sometimes, and nobody wants to hear that. I mean,
Yeah.
But it's true. And some people know it and will admit it, others won't admit it. But the point is, they're still in pain. So one of the devices that works very well is we have something called a Neuromed, which is electroanalgesia. And there are a few different varieties of that type of machine out there. But basically, it works to get rid of edema and inflammation, which we know causes pain, as well as different algorithms. In other words, different electrical muscle stimulation frequencies. And some of those are very, very high and some are very, very low. It's unlike your typical electric muscle stim machine. So that works very, very well, especially at the high frequencies, to block pain signals to the brain. It's kind of like what the opioids do, only a lot safer. So that's one of the first things that we do. And the next thing, of course, is to try to correct the problem, as we discussed before. And that depends on, of course, what it is and any of the modalities that we've already discussed that might apply. So that would be either, a spinal decompression program, chiropractic, and or your knee machine, knee decompression, or I don't know if I just mentioned cold laser. So those are the main things. Stretching. A lot of the problems too, which is widely overlooked in many offices, or just the modalities are underutilized, as you know, is just trigger point therapy. Because if once you know the body, and you know the musculoskeletal system, right? I mean, so many people have these referral points, and they become a monster of their own. Because,
they do. They definitely
right. Then that's why I get back to it's the neuromusculoskeletal system. You have to look at all of it, because once a guy's got trigger points, muscles have their own, as you know, they have their own referral system. So, and a lot of it will mimic disc herniation, right? It will mimic sciatica or create a type of sciatica, but it's not necessarily dealing with a nerve impingement. It's more of a muscle issue. So that's where your clinical skills come into play, as and once we're willing to take a look at that, and sometimes it just takes time to spend a little extra time with the patient to get to that, come to that conclusion, and of course incorporate that treatment.
It does come down to just diagnosing the actual problem, because there could be so many different things, and it could present in many different ways. And sometimes the pain you're having is really not where the source of the pain is coming from. So I think, like you said, taking the time to actually diagnose these problems and know exactly where the battle is, then you'll know how to fight it and you'll know how to fix it.
Right. And be willing to roll up your sleeves and work on it. Right.
Yeah.
Because right. How many times do you see that where, you see this, the person's been to wherever, and it's with any discipline. Okay. No one's exempt. It's almost, you look and you almost like, how does that other person or that other place not know this? And I think most of it is, it's not that they didn't know, it's that they didn't really incorporate those treatments.
Yeah.
Well, that, or they don't care, because they don't care to do the work. Let's put it that way.
Yeah. Well, one of the cool things is, like, my office, I'm sure as yours, is really a one-stop shop for all health needs. And that's really the key. I mean, the only thing we really don't do in my office is surgery. So everything else can be handled in there, whether it's weight loss, chiropractic, decompression, laser, orthotics. I mean, we try to do it all because I want people to have that one-stop shop mindset there.
And you do deliver. I know you do on those aspects. Even I heard you're even doing neuropathy. So that makes it.
Yeah, that's a huge problem that we were doing too. That's becoming more prevalent as well. Yeah, there's just so many things out there, and it's important to stay up to date. And I know you've done that. You've been in practice 25 years, and you stay up to date on this. You do your research, and I know your community appreciates what you do, and I know your patients have been with you for a long time. And I wanted to ask you, how do people get in touch with you? You have a lot of good advice. You have a great practice there in Scranton. How do people get in touch with you or your office?
Well, you can call us 570-341-7062. That's the good old-fashioned telephone certainly works and is welcome, right? Or you can check out my website. It's painfreescranton.com.
Well, thank you for sharing with us today. And again, Doc, we appreciate everything you're doing. As a fellow chiropractor, keep up the good fight. You know, you're helping people more than you realize. I just hope that more people get aware of this situation, because it's definitely been around a long time, but now it's actually getting some light. And I'm hoping that we're turning the corner on this pandemic, that people are more aware of opioids and know the actual side effects and the outcomes that can happen by getting addicted to those things.
Yes. And it's so insidious. And it breaks my heart, honestly, to see someone under the grips of, anything, and especially drugs, because it's very, very insidious. It robs them of not only quality of life, but life with their family as well, friends and other relationships. So certainly something that I would like to keep people away from if we possibly can. Having said this, there is some necessity, short-term use, of course, right? Of drugs and medication, pain medication. So I'm not saying, don't ever do it. If God forbid you have a certain type of injury, but there are certainly alternatives, and people should, as soon as possible, seek the alternatives that we've just talked about, that they previously may not have known existed, because it doesn't exist in every chiropractic office or in every physical therapy office. That's or right. In any medical office, in every medical office. So, my advice is, choose wisely, research your practitioners, see what they've got to offer, speak with them, and then make a wise decision from there, knowing, of course, that there are dangers, especially with opioids involved.
I couldn't agree more. Well, Doc, thanks again on this Sunday, and I'll let you get back to your sauce today. I did think about making some today while I was doing a bunch of other work. Thank you. Yeah, I had a friend from New York come in a week or two ago, and he made this Italian feast, and we had a bunch of people over the house, and I used to love doing that when I was living in New York. So
right,
he made some phenomenal bolognese sauce and meatballs, and made this whole spread of food. I mean, it was like enough for an army, and we still have leftovers.
Yeah,
we'll probably have for months.
It's funny. My daughter was in last week, and she did this same thing. She brought these incredible pastries and all the things, that we're not supposed to eat, right? But once in a while, I guess we're going to do it anyway. It's a celebration of culture and life. And whenever people get together and share their culture, it's certainly a wonderful thing, and much enjoyed. But I wish I had more friends like that. Where are these people? Send them my way.
I don't know. They're few and far between. But when you find them, you want to keep them around. That's for sure.
Absolutely. Yes. So, okay. Well, thank you for your time. Yeah,
absolutely. Thank you.
Good to talk to you again. So, all right. So be well and have a wonderful week ahead.
Thank you. You too. So some takeaways from today's episode are that the most important thing is to figure out where the pain is coming from. Treatment is definitely not the first thing you should be doing, whether it's going to a doctor, a massage therapist, or whatever you end up doing, or PT. It's really important to actually find the root of the problem and get to the cause, find where it's coming from and why it's happening. And then you can figure out how to treat it. So the problem with most people is they'll just look something up, watch a video, and then they immediately start going into treatments. But if you don't actually know what the true problem is, you may be making it worse. And as Dr. Vito said, he really has gone through a lot of extensive research over the years to understand why people are having these problems, and also understand some of the medications they may be on, so that they can really find the root of the problem and give alternative solutions. Like we've talked about chiropractic, spinal decompression, K-laser, custom orthotics, trigger point work. There's a lot of different things you can do for these injuries. And once you find out where it's coming from, then you can actually apply the correct kind of treatments. So again, the next step is to find out why this is happening. So what I want you to take out of this episode is get with me, try to figure out why these things are happening. So DM me on social media at Ideal Health and Wellness Center, either on Facebook or Instagram. Remember, the coach's door is always open. This is Coach Frank. I'm sporting good posture. How about you?
The Sporting Good Posture Podcast is a broadcast wellness production powered by Ideal Health Wellness Center. All content copyright 2021. All rights reserved. Executive producer Frank Sardella. Coach Frank appears courtesy of Ideal Health Wellness Center in Franklin. For more information, visit sportinggoodposture.com and follow Coach on Instagram at sportinggoodposture.
In 2020, he was recognized by Dr. Eric Clapton. Dr. Eric Clapton.
Oh, that was awesome.
Here's your outtake for today.
I was going to say, that's my favorite blooper of all time. Dr. Eric Clapton. That's the best. Please welcome to Sporting Good Posture, Dr. Eric Clapton. All right. All right, man. Do it right.
All right.
I notice you're sporting good posture. I sport good posture too.